Hey Tiff, so just do me a favor, go ahead and verify that you're okay with me filming you for this physical assessment. Is that okay with you? What's your
Yes.
name? And let me know.
My name's Sydney Urbanus. I give Joseph Urbanus permission.
Alright, so now we'll start the assessment. Knock on the door. Hey, Mr. Urbanus, my name's Andrew. I'm going to go ahead and be your nurse tonight. Before I get things going, can I get your name and date of birth?
Tiffany Urbanus, 6/16/83.
Okay, so the reason I came into the room is just to go ahead and do an assessment. I'm going to go ahead and listen to your heart and to your lungs, okay? And if throughout the procedure, actually, I'm going to go ahead and have you sit up at the edge of the bed at some point in time. You feel like you can actually sit up on the edge of the bed for me? Okay, good deal. First thing I'm going to do is I'm going to go actually and listen for, I'm going to take a look at the, if you can turn your head to the left. So I'm going to look for jugular vein pulsations, okay? And that is recognized right here. And next thing I'm going to go ahead and do is I'm going to go ahead and feel for your carotid. And alright. If you can turn your head to the other side, I would never want to do both sides at once because that could actually cut off blood flow to the brain. And Mrs. Urbanus could have an interesting time. There's no sign that I don't feel, there's no thrill at all. Next thing I'm going to go ahead and do is actually I'm going to listen on both sides for you for a thing called a bruit. That is basically, how would I put it? Like a rumbling almost that you can hear, and that would have to do with blood flow, and that could lead to other things, but we'll see what's going on. Okay, so I'm going to go ahead and take a quick listen. Now to the other side of the bell. Okay, good. No sign of bruit, no feel of thrill. We're good. We're doing okay. All right. Next thing I'm going to go ahead and do is I'm going to work my way down. So I'm going to go ahead and palpate your chest. I'm going to go ahead and feel my way down here to see if everything just feels normal. I don't feel a thrill in between the intercostal spaces, anything like that. Okay. All right. So I'm going to start right here on the right side. Second intercostal space. Work my way down. Okay, and work my way here just between, okay, Mrs. Urbanus, and I would normally have Mrs. Urbanus go ahead and lift, and I would feel all the way down, and over here, just, sorry, my hands are cold, Mrs. Urbanus, I apologize. Sorry about that. Let me go ahead and wash my hands again here, and I'm going to go ahead and put these gloves on. That'll make things a little bit easier, I'm sorry. So now that after I palpated, I'm going to go ahead and I'm going to go ahead and listen. I'm going to start here at the aorta, and I'm going to work myself over across to the right side of the sternum, and that's going to be onto the second intercostal space, and that's the pulmonic valve. And I'm going to work my way down to Erb's point, which is intercostal space 2, 3, and 4. And then over to the PMI, which is the point of maximum impulse, which is the apex. And at that point, I'm just going to actually ask you to just lift your breast up for me, okay? If that's all right, so I can listen. All right, perfect. Okay. Go ahead and lift this, okay? Okay, and would you mind just go ahead and lift your breast? Thank you. And this is the fifth intercostal space, midclavicular. Okay, perfect. And at my point of listening, I didn't hear any murmurs. Clear S1 and S2 for the heart. So everything sounded okay, all right? And one thing I do have to ask you to do is actually, do you mind sitting up on the edge of the bed here for me? I can give you a hand if you'd like. And normally in an assessment, I wouldn't go ahead, but I think I might have to reposition the camera real quick. this point, so what I'm going to do is actually, I'm just going to go ahead and ask you to lean forward for me, all right? And I'm just going to go ahead and listen to a place called Herb's Point, which is right around here, just to listen to your heart for any murmurs or any abnormal sounds, okay? And that concludes listening to the heart. All right, next thing we're going to do is go ahead and listen to your lungs, okay? Uh, just by first things first, patient doesn't look like she's in any respiratory distress. Inspiratory and expiratory breaths are equal. No signs of distress for the patient. First thing I'm going to go ahead and do is I'm going to go ahead and palpate. And I'm going to go ahead and just feel here to see if I feel any air in the chest at all. All right. Nothing down the lower lobes. Okay. All right. Okay. And the next thing I'm going to do is go ahead and listen to your lungs. All right. Well, actually, the first thing I'm going to go ahead and do is I want to do is tactile fremitus. Okay. And the tactile fremitus is basically I'm going to use the bottom part of my palm here, and I'm going to go ahead and ask you to say the number 99 a few times. Okay. That way, what that's doing for me is letting me if the vibration should be equal on both sides. Okay. So when I ask you to, when I move my hand, you're just going to go ahead and say
99. 99. 99.
If you can lift this pressed up for me. Okay.
99.
And this one.
99.
Okay, perfect. Vibrations are bilaterally equal. Next thing I'm going to go ahead and do is I'm going to go ahead and listen, okay? All right, each time that I do, just do me a favor and take an even breath in and out, okay? All right. And I'm actually start above the clavicle here on both sides, all right, when I do. Is there a way for me to move this a little bit? Okay, I'll start right here. Okay. Deep breath. Again. Bronchovesicular sounds are bilaterally equal. The breath sounds sound good. I don't hear any bronchi, no crackles, no inspiratory, expiratory wheezes. Okay. All right. And let's see. So the next thing we're going to go ahead and do is I'm going to go ahead and move to. All right, Mrs. Urbanus, we're back. Normally in a assessment, a 3-year-old wouldn't walk into the bedroom because they were scared. So we are back to this. Okay. So let's just pick up right where we were at. All right. Do me a favor. Can you go ahead and position yourself actually so the camera can see your back? We're going to go this way. All right. And the first thing I'm going to do, of course, is I'm going to assess the back of the patient. I'm going to go ahead and look and see her respiratory, no respiratory distress. Her breaths are equal, inspiratory and expiratory. Okay. I'm going to go ahead and palpate her back. Sorry if my hands are cold. All right. Okay. In between intercostal spaces. Okay. And then the next thing I'm going to do with the patient is I'm actually going to do tactile fremitus again. So do me a favor. What's the famous number? We have to say 99, right?
Oh,
93. 99. What?
99. 99. 99. 99. 99.
And the vibrations are equal on both, bilaterally equal. After I've palpated and I have done tactile fremitus, I'm going to go ahead and percuss in between the intercostal spaces. The lungs are made up of 99% air, so therefore the fact that I should hear, it should resonate. Okay. resonation is heard, no dull sounds at all. After I do that, I actually have to do diaphragmatic what do I have in a moment? Diaphragmatic excursion. Sorry about that. Diaphragmatic excursion. What that's going to do, it's actually going to go ahead and help me to see how much the diaphragm itself moves when the patient breathes in and when they breathe out. So the first time actually, so what I'm asking you to do, Mr. Urbanus, is the first time around that I go ahead and listen, I'm going, when I do the percussions, I'm going to ask you to take a deep breath in and hold it for me, okay? And I'm going to go ahead and listen for when it actually becomes a dull sound, and then I would mark that with a Sharpie, but I don't, or a marker I should say, something that's erasable. I don't think my patient here would like that very much at 1 o'clock in the morning doing this, but that's what I would normally do. So go ahead and take a deep breath in for me. Okay. So this is where it becomes dull. You can let that breath out. Sorry, that took some time. Okay. Now the next thing I'm going to ask you to do is I'm going to ask you to take a deep breath in. And I would mark it right there. And so I'm going to take a deep breath in, and I'm going to ask you to go ahead and let it out. And hold that out, okay, for me. Now the next thing, I'm going to go the opposite way. Start a little point that I had marked, where it's dull. And I would mark, and that's where I hear the resonation. So you can go ahead and take a breath, you're okay. And I would mark that point between here, and for a normal person, between 3 and 6 centimeters is normal. If you get an athlete, somebody that is in really good shape, you might have some movement about between 7 and 8 centimeters. The next thing I would do, if you can actually kind of turn a little bit more, Ms. Urbanus, I'm actually going to go ahead and check for symmetry here. I'm going to hold the 10th rib down here, and let's see if I can do this right here like this. I'm going to ask you to take a deep breath in. And let it out. And as you can see, my thumbs actually go back to the middle equally. All right. I'm going to go ahead and listen, okay? Now each time that I do, I'm going to ask you to take a big breath in and then let it out, okay? All right. Okay. Go ahead. All right. Okay. And then do me a favor, can you put your arms out in front of you, kind of cross them like a genie? Thank you. And lift up your shirt, okay? And take a deep breath in. And then on the side, same thing. Breath in. And let it out. Okay. Okay, you can put your arms down. I'm not, you don't have to make any wishes, Jeannie. It's okay. Okay. Next thing we're going to actually do, there's only a couple more things that we're going to have. We're going to have a thing called bronchoscopy. And at that point, I'm actually going to ask you to say 99, okay? But I'm going to go ahead and listen with my stethoscope, okay? And then after that, I'm going to ask you to whisper to yourself the numbers 1, 2, 3, all right? But not 99, then 1, 2, 3. We'll do 99 through, and then we'll do 1, 2, 3 through, okay? Okay. Okay. 99.
99. 99. 99. 99. 99.
Okay. I'm not actually able to hear the words. It's just more of basically muffled, which is what we were looking for with that. And then we're going to do a thing called egoscopy, which I'm going to actually just ask you to say the letter E, okay? And what that's going to go ahead and do is, if I should be able to hear the letter E all the way through, it should resonate. If I don't, if E turns to A, that means there just might be some consolidation in the lungs, and we can look into that further, okay? Okay. Okay.
E, 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 E.
Okay. And just as I thought, I heard E all the way through, no signs of consolidation in the lungs. And that concludes our examination. And, oh wait, hold on. So I'm missing, oh, yeah, I'm missing one thing that I have to do for you, okay? Thank you for reminding me, Mrs. Urbanus. Sometimes the patients actually do know better than So I actually have to do the 1, 2, 3. I'm going to go ahead and listen for you to do that. And do me a favor, I'm going to need you to whisper that, okay? All right. Okay. Okay. And no signs of consolidation there either, okay? All right. So now that would conclude everything. Do you have any questions in regards to the examination? No? You've been a trooper. I do appreciate you. It's probably time for bed. You had a long day at work, didn't you? You were telling me all about it. We were waiting for it in the ER tonight, weren't you? All right, perfect. You're all set. You have a nice afternoon. If you need anything, just about hit your call light. We'll be in to take care of you, okay? All right, let's get you back into bed because I can't leave you actually sitting up in the bed. Got to make sure that you are safe and your call light is within reach, and that you go ahead and have your bed alarm on, and we're all set. Thank you. And wash my hands on the way out. Shut off the lights. Shut the door.